One of the biggest fears when somebody's first diagnosed with HIV is, how am I going to pay for this?
Dylan Boyer's HIV medication, Biktarvy, costs more than $3,000 a month.
So if you break that down per pill, it's over $100 per pill.
Now that and other HIV drugs produced by Gilead are up almost 5% in 2020. Boyer's costs are covered by federal grants and insurance, but his colleagues at the HIV Wellness Center, the Aliveness Project, know not everyone has that luxury.
Rising drug price costs just adds additional barriers to what is already difficult work.
Gilead argues that the list price of a medication does not reflect the actual cost to patients because of the way the rebate system works. Many drug companies are saying just that, with average drug prices up 5.8%.
Categories for some very critical conditions have gone up dramatically.
Dr. Stephen Schondelmeyer partly blames an unregulated system that claims to reward innovation with profits, but doesn't in practice.
It doesn't differentiate between the company bringing true innovation to the market versus this company just finding a new way to keep charging higher prices.
What is the best way to tackle this issue and to bring the prices down?
Part of that will be to look at our patent laws and how we reward innovation in society. Part of it will be holding drug companies accountable for their prices.
Lawmakers from both parties have agreed that something needs to be done.
Talk to your senators, your local people, to be able to get out there and say that this is unacceptable for people living with HIV.
A task force headed by State Attorney General Keith Ellison is releasing a report later this month on how to lower drug prices. The increase we're seeing in 2020 is not quite as steep as the increases seen in recent years, but it is still double the rate of inflation. Back to you.
All right, thank you, Danny.